Good afternoon. My name is Nicole Boyett, and I work on the UMP account management team at Regents Blue Shield. Welcome to the 2022 SEBB Open Enrollment webinar. Please note this webinar is for the School Employee Benefits Board, or SEBB program. The Public Employee Benefits Board, or PEB Open Enrollment webinar will be November 3rd at 12 p.m. Pacific. If you are not sure which program you belong to, here are a few ways to tell. PEB members include public employees or dependents, including state agency, higher education, or municipality, retired public or school employees or dependents, and current or former public employees or dependents who are enrolled in continuation coverage. SEBB members include school employees or dependents, including district, charter, school, or union represented ESD, and current or former school employees or dependents enrolled in continuation coverage. If you believe you are a PEB member, you can register for the PEB webinar using the link our host is placing in the chat now. Before we begin, I have a few housekeeping reminders to share with you. First, please submit your questions into the Q&A module and not in the chat, using the button at the bottom of your screen. This is extremely important so we can keep track of all questions raised during today's presentation and make sure they are answered. We have experts from UMP Customer Service and Washington State Prescription Services available to answer your questions. If you have a technical issue or concern, please feel free to raise that concern in the chat and we can assist you. This webinar is being recorded and a link to the webinar will be sent to the email address you registered with. Thank you for joining me today. Let's get started. It's open enrollment time and Uniform Medical Plan is ready to meet your healthcare needs with several plan options that will be reviewed during this webinar. UMP medical benefits are administered by Regents Blue Shield. UMP prescription drug benefits are administered by Washington State Prescription Services. Regence partners with a large network of providers in Washington, and UMP members have access to well over 40,000 network providers. With a UMP plan, you can also save on quality care from one of the largest provider networks across the country because 96% of hospitals and 93% of doctors and specialists nationwide are in network. You will also have access to network providers when traveling around the world through Blue Cross Blue Shield Global Core. You can easily fill a prescription or get a covered vaccination at a pharmacy near you because Washington State Prescription Services has over 52,000 network pharmacies across the United States. A convenient mail order pharmacy option through Postal Prescription Services to fill prescription drugs is also available to you on all UMP plans. Open enrollment for SEBB began October 25th and ends November 22nd. Everyone who is enrolled in UMP for plan year 2022 will receive a new member ID card. You will need to use your current ID card through December 31st, 2021. Your new ID card will not work until January 1st, 2022. You use the same ID card for both medical and prescription drug services. The new member ID card will include updated information that you will want to share with your providers and pharmacies. If you need to fill a prescription in 2022 before you receive your new ID card, you can provide the pharmacy the following information when filling your prescriptions: PCN, NVTU, BIN 610602, RX group number 100-16720, and our host has also placed this information in the chat for your reference. Members new to a UMP plan will need to contact UMP customer service at 1-800-628-3481 to get their member ID number. This information is required in addition to the PCN, BIN, and RX group number. Chiropractic, acupuncture, and massage benefits are changing in 2022. All UMP plans will have a limit of 24 visits for chiropractic, spinal manipulation, 24 visits for acupuncture, and 24 visits for massage per calendar year. This is an increase to the previous benefit limit of 16 visits for chiropractic, 16 visits for acupuncture, and 16 visits for massage. When you see a preferred provider or a network provider for UMP Plus, you will pay a $15 copay per visit for each treatment type. For UMP High Deductible, you must meet your deductible before the $15 copay will apply. Please note, there is no coverage for out-of-network massage therapy on any UMP plan. Continuous glucose monitors, or CGMs, will only be covered under your prescription drug benefit in 2022, which is administered by Washington State Prescription Services. UMP will no longer cover CGMs under the medical benefit. You will need a new prescription if you are currently getting your supplies through your medical benefit. This change does not apply to Medicare retirees when Medicare is their primary health coverage. UMP Plus service area and program changes. UMP Plus Puget Sound High Value Network, or PSHVN, will no longer be available in Thurston County in 2022. PSHVN will remain in Chelan, Douglas, King, Kitsap, Pierce, Snohomish, and Yakima County. UMP Plus UW Medicine Accountable Care Network, or ACN, will still be available in Thurston County in 2022 and is very similar to UMP Plus PSHVN. UMP Plus UW Medicine ACN has partnered with Embright to make it easier for UMP members to get the care they need when they need it by fostering better collaboration between your doctors and providing innovative tools, ideas, and support. Because of the new partnership, UMP Plus UW Medicine ACN's customer service number and nurse line will be changing to 1-888-402-4238 beginning January 1st, 2022. The plan comparison shows you a side-by-side view of the 5 different plan choices. UMP Achieve 1, UMP Achieve 2, and UMP High Deductible Plan are all available for enrollment worldwide and include network access to preferred providers worldwide. UMP Plus PSHVN is available to you if you live in Chelan, Douglas, King, Kitsap, Pierce, Snohomish, or Yakima County. These are also the counties that make up the service area for this plan. UMP Plus UW Medicine ACN is available to you if you live in King, Kitsap, Pierce, Skagit, Snohomish, Spokane, or Thurston County. These are the counties that make up the service area for UMP Plus UW Medicine ACN. Each plan has an annual medical deductible, and some have annual prescription deductibles. The deductible is the fixed dollar amount you must meet each calendar year for services before the plan starts paying for covered services. Some items, including covered preventive services, are not subject to the deductible. Each plan also has coinsurance, which is the percentage of the allowed amount you must pay the providers on claims for which the plan pays less than 100% of the allowed amount. The annual out-of-pocket limit is the most you pay during a calendar year for covered medical services when you see a preferred or network provider, and for covered prescription drugs and products when you use a network pharmacy before the plan pays 100% of the allowed amount. Most plans have separate out-of-pocket limits for medical and prescriptions. Premium is the amount you pay for your health plan each month. For premium purposes, a family includes the subscriber, spouse, or state-registered domestic partner and children. UMP Achieve 1 has an individual premium of $37 and $111 for a family. UMP Achieve 2 has premiums of $101 for an individual and $303 for a family. The premium for UMP High Deductible is $25 for an individual and $75 for a family. UMP Plus, PSHVN, and UMP Plus UW Medicine ACN have individual premiums of $77 and family premiums of $231. A sample of benefits is shown here to illustrate the difference in coinsurance between the 5 plans offered by UMP SEBB. All plans pay 80% of covered ambulance services, and you pay 20% coinsurance. Coinsurance is the percentage of the total cost you pay for covered services. For the remainder of most benefits on UMP Achieve 1, the plan pays 80% for covered network services, and you pay 20% coinsurance. On UMP Achieve 2 and UMP High Deductible, the remainder of most network benefits are covered at 85%, and you pay 15% coinsurance. On UMP Plus, most network services are covered at 85%, and you pay 15% coinsurance. However, for UMP Plus network PCP office visits, you pay $0. On all plans, you pay $0 for covered preventive care with a network provider. You pay a coinsurance for most prescription drugs, which is a percentage of the total cost of the prescription drug. Your coinsurance depends on the total cost of the drug, its tier on the UMP Preferred Drug List, or PDL, and the day's supply of the prescription. The table shows how much you will pay per 30-day supply. You may get up to a 90-day supply for most drugs, except for specialty drugs. Specialty drugs are high-cost injectable, infused, oral, or inhaled drugs or products that require special handling and storage. You can find out if a drug is a specialty drug by checking the UMP PDL at hca.wa.gov/UMP-PDL, or by calling Washington State Prescription Services. Specialty drugs are limited to up to a 30-day supply and must be purchased through the plan's network specialty pharmacy, Arden Health. As a UMP member, you have multiple virtual care options in 2022. Your network telemedicine options can be explored using ump.regence.com/SEBB/benefits/telemedicine, or by calling customer service. Cost for telemedicine visits with a network provider will be no more than you would pay for an in-office visit, and it is subject to the deductible. UMP Achieve 1, UMP Achieve 2, and UMP High Deductible members have network access to Doctor on Demand, which consists of video call consultation visits with a board-certified doctor or licensed therapist, as well as non-urgent medical and behavioral health needs. Doctor on Demand is available in all 50 states, 24 hours a day, 7 days a week, 365 days a year. You pay the standard rate and it is subject to the deductible. To learn more about Doctor on Demand, visit ump.regence.com/SEBB/benefits/telemedicine. Dispatch Health is available to SEBB members on all UMP plans. Dispatch Health provides urgent care home visits by emergency personnel for complex injuries or illnesses 7 days a week in Portland, Tacoma, Seattle, and Spokane from 8 a.m. to 10 p.m. and Olympia and Boise from 9 a.m. to 9 p.m. You pay the standard rate and it is subject to the deductible. HEAL provides home visits by doctor and lab technicians for primary care and urgent care. It is available to UMP Achieve 1, UMP Achieve 2, and UMP High Deductible members in the greater Seattle area and Spokane only from 8 a.m. to 8 p.m. 7 days a week. You only pay your standard coinsurance amount and it is subject to the deductible. Advice 24 is available 24 hours a day, 7 days a week to UMP Achieve 1, UMP Achieve 2, UMP High Deductible, and UMP Plus PSHVN members at no cost. When you're not feeling well and you're not sure what to do, a registered nurse can help you with the information and support you need. For UMP Plus UW Medicine ACN, you can reach their 24/7 nurse at the contact number listed on the back of your ID card. Please note, UMP Plus UW Medicine ACN nurse line number is changing effective January 1st. Members call 1-888-402-4238. UMP plans offer a variety of programs to help you improve your health. Learn more about these programs, including cost, eligibility criteria, and how to participate on the UMP website. Programs include knee and hip replacement, spine care, diabetes prevention, diabetes control, palliative care, tobacco cessation, maternity support, and expert second opinions. Regence has a convenient mobile application that allows you to have a lot of information at your fingertips. When you create a Regents.com account and download the Regents app, you have access to the most current information. You can search for a network provider, see provider ratings and reviews, learn about care on demand telemedicine options, find COVID-19 testing and treatment resources, find out how to get extra support with care management, and so much more. You can also sign in through your Regents.com account to access health equity, high deductible members only, and Washington State prescription services. Whether you're using an iPhone or an Android phone, the Regents app provides easy and secure access to your personalized dashboard where you can find network doctors, hospitals, and urgent care clinics. You can contact customer service with one tap or securely send a message. The Regents app allows for easy appointment check-in when you show your digital member ID card. It also allows you to view your claims and explanation of benefit statements, review your copay, deductible, and coinsurance amounts, as well as download a copy of your certificate of coverage. If you enroll in UMP High Deductible, your plan comes with a health savings account. The health savings account with health equity allows you to have more control over your healthcare dollars. You will receive a Visa debit card issued by Health Equity to use for your healthcare expenses. You can download the Health Equity mobile app to easily access your account, pay providers, view your claims, and contact Health Equity with any questions you may have. We hope this webinar has been helpful in explaining some of the differences between the UMP plans for 2022. But if you still have questions, we have resources to guide you through open enrollment. We encourage you to visit the SEBB open enrollment website listed on the screen to learn even more about the UMP plans offered for SEBB. This website provides detailed information on the UMP SEBB plans, including plan comparisons, and a list of what's new for 2021. Additionally, you can watch recorded webinars like this one and presentations and attend virtual benefit fairs. Contact information for UMP customer service as well as Washington State Prescription Services. You can even access Ask Alex, the interactive virtual guide, to help determine which plan is right for you. Frequently asked questions. What is a premium? Premium is the monthly fee you pay to have health coverage. The amount you pay for your premium does not apply toward the deductible. What is the difference between copay and coinsurance? A copay is a fixed amount you pay for a medical service. For example, you may have a $20 copay when you visit the provider's office, and the health plan pays for the rest of the visit cost. The UMP plans do not have standard office visit copays. UMP Achieve 1, UMP Achieve 2, and the UMP Plus plans have an inpatient hospital and ER visit copay. Coinsurance applies after your deductible, but instead of paying a fixed amount like a copay, you pay a certain percentage of the medical visit cost until you hit your out-of-pocket limit. What is a deductible? A deductible is the amount you pay for care before your health plan starts to pay its share of the medical costs. For example, if your deductible is $250, you will pay the first $250 for medical care out of your own pocket, and then UMP will begin paying a percentage of all care. Provider visits, prescriptions, and emergency or urgent care costs all contribute toward your deductible. Eligible preventive services like routine mammograms and covered immunizations are always provided at no cost to you when you see a network provider, regardless of if you have met your deductible or not. What is an out-of-pocket limit? Your out-of-pocket limit is the most you pay during a calendar year for covered medical services before the plan pays 100% of the allowed amount for network providers. For example, if your out-of-pocket limit is $2,000, once you pay $2,000 in deductibles, copays, and/or coinsurance, your health plan will pay 100% of any covered network provider medical expenses for the rest of the year. What are the biggest differences between the plans? The two UMP Plus plans, UW Medicine ACN and PSHVN, have limited provider networks. If you live within certain counties and you see providers within one of these networks for most of your care, these plans are very cost effective. The UMP Achieve 1 and UMP Achieve 2 plans are very similar in benefits, but have different premiums, deductibles, and out-of-pocket limits. In general, paying a higher monthly premium will give you a lower deductible and a lower out-of-pocket limit. The provider network for these two plans is the same nationwide network. The UMP High Deductible plan has the lowest monthly premium and the highest deductible. However, this plan comes with a health savings account, or HSA, that you can use toward IRS qualified medical expenses. The SEBB program also contributes to your HSA, and the funds in your HSA never expire. Are referrals needed for anything? No, referrals are not required on any of the UMP plans. How do I find out if my provider is in my plan's network? To find out if a provider is in your network, visit the provider search feature on UMP's website at ump.regence.com/SEBB/finding-doctors. How are benefits coordinated if I have other medical coverage? If UMP is your secondary plan, it is non-duplication of benefits. This means UMP will only pay up to what it would pay if it were primary. For example, primary insurance pays $100. UMP would have paid $100, so it pays nothing. Example 2, primary insurance pays $80. UMP would have paid $100, so it pays $20. Is massage therapy covered? Yes, massage therapy is covered as long as you use a network provider. What's changing for the UMP prescription drug benefits in 2022? Continuous glucose monitors will only be available under UMP's prescription drug benefit. The Washington State Prescription Services online account might look different, but you will have access to the same tools. Will I get a new ID card? Yes, a new member ID card will be mailed to you. Please remember to show your new ID card at the pharmacy when you pick up your first prescription filled in 2022. Use your current ID card through December 31st, 2021. Your new ID card will not work until January 1st, 2022. If you don't have a new ID card on hand, you will need to share the following information with your pharmacy starting January 1st. PCN NVTU, BIN 610602, RX group number 100-16720. Members new to UMP will need to contact UMP customer service to get their ID number. This information is required in addition to the PCN, BIN, and RX group number above. I'm a current UMP member. Will I still be able to get my prescriptions and use my current pharmacy? UMP is focused on ensuring members will be able to access a broad range of pharmacies for your prescription needs. If there's a change that will negatively impact your coverage, Washington State Prescription Services will contact you at least 60 days before with details about what you need to do. How do I check which pharmacies are network pharmacies in 2022? To check which pharmacies are available in the Washington State Prescription Services 2022 Pharmacy Network, visit the UMP SEBB Open Enrollment webpage at ump.regence.com/SEBB/benefits/OE-2022 and use the 2022 Pharmacy Locator. The 2022 Pharmacy Locator is subject to change. After January 1st, 2022, visit the prescription drug coverage webpage at ump.regence.com/SEBB/benefits/prescriptions. The Washington State Prescription Services 2022 Pharmacy Network will include over 52,000 pharmacies nationwide, including most major chain pharmacies and most independent pharmacies. I'm considering enrolling with UMP, and I'm currently taking a prescription drug. How will this be covered by UMP? There may be changes in how your prescription drugs are covered under UMP. To get a general idea, use the UMP Preferred Drug List, or PDL, on the HCA website at hca.wa.gov/UMP-PDL to find out if your prescription requires a pre-authorization, has a quantity limit, is a step therapy, or is a specialty drug. The PDL is subject to change. Pre-authorization for non-specialty drugs will be waived for the first 90 days you are enrolled in UMP. If you are taking a specialty drug, call Washington State Prescription Services to request a pre-authorization in 2022. Washington State Prescription Services will work with you and your prescribing provider to obtain information to complete the review of the specialty drug and begin the specialty pharmacy enrollment process. If possible, try to refill your prescription before your plan changes on January 1st, 2022. To check how much your drugs will cost in 2022, visit the UMP-PEB open enrollment webpage at ump.regence.com/seb/benefits/OE-2022 and use the drug price check tool. The drug price check tool is subject to change. I was on a UMP plan in 2021 and will need to view my 2021 prescription history or tax reports in 2022. How can I view this? To view your previous prescription claims history in 2022, you need to access your prescription claims history by December 31st, 2021. Claims histories may be needed for health savings account submissions, flexible spending account submissions, or tax purposes. By viewing your claims history before the new year, you have access to previous claims. You can view your claims by signing into your Regents account at ump.regence.com/UMP/sign-in. After you sign in, select My Benefits and choose the Pharmacy tab. Then select Sign into your pharmacy account and select Claims for your name. If you have questions, please call Washington State Prescription Services Customer Service at 1-888-361-1611. I'm taking a drug that's no longer covered by UMP. How can I request an exception? If you have tried all covered alternative drugs and none are found to be effective, or if the alternatives are found to be not medically appropriate, you or your prescribing provider can request an exception by calling Washington State Prescription Services at 1-888-361-1611. Washington State Prescription Services will work with your prescribing provider to submit the required clinical information. Can prescription drugs change tiers, or can UMP stop covering a prescription drug mid-plan year? Yes, common reasons may include, but are not limited to, a more cost-effective alternative is available to treat the same condition, a non-prescription alternative, including an over-the-counter alternative, becomes available. For a list of changes, refer to the UMP preferred drug list. If I paid out of pocket and need to submit a claim, will I need to do anything different? For prescription drugs filled in 2021, the claims process is the same. You will need to complete a paper claim form at ump.regence.com/seb/forms/common-forms, then mail it to the address on the form. For prescriptions filled in 2022, there will be a new prescription drug claim form that you will need to complete. This form will be available on January 1, 2022 on the same webpage mentioned above. These claims will need to be mailed to Pharmacy Manual Claims, P.O. Box 999, Appleton, Wisconsin 54912-0999. How can I get my prescription drugs mailed to me? Postal Prescription Services, or PPS, is UMP's network mail order pharmacy. To get started, create an account at ppsrx.com or call 1-800-552-6694. For more information, contact Washington State Prescription Services Customer Service at 1-888-361-1611. Why does my prescription drug cost more than before? At the beginning of the year, you may have to pay a deductible. Covered insulins are not subject to the deductible. You pay the first, achieve two $100 or achieve one $250 per member in prescription drug charges. Achieve 2 $300, Achieve 1 $750 maximum for a family of 3 or more on one account. Only expenses for Tier 2 drugs covered by the plan apply to your deductible. For example, if you receive a prescription for a drug for cosmetic purposes, the plan does not apply the cost of a non-covered drug to your deductible. Thank you for attending the UMP SEBB 2022 Open Enrollment webinar. Please visit our website for more information. Wishing you a healthy year in 2022.